It's the Sound of Ideas from 90.3. I'm Rick Jackson. Thank you for being here today. An ongoing conversation here on the Sound of Ideas is the action taken by municipalities across the state and the country declaring racism a public health crisis. These declarations are generally seen as a first step in addressing systemic inequalities and racist institutions through the lens of public policy and public health. The League of Women Voters of Ohio recently convened several community forums to discuss these declarations, one with a panel of elected officials, another with health experts. Last week, we brought you excerpts of the first conversation featuring the voices of leaders like House Minority Leader Amelia Sykes and Cuyahoga County Councilwoman Chantel Brown. Today, we'll share some of the remarks from the second of those two conversations. This panel made up of healthcare experts from around Northeast Ohio and moderated by ideastream's Health Unit Manager Marlene Harris-Taylor. The panelists included David Maywhoor, Executive Director of the Ohio Public Health Association, Dr. Charles Modlin, a surgeon and urologist at the Cleveland Clinic, who's also the founder of the Minority Men's Health Clinic here, Iris Harvey, President and CEO of Planned Parenthood of Greater Cleveland. We had Ms. Harvey on the program earlier this month to preview this conversation. And Yvonka Marie Hall on the panel. She's Executive Director of the Northeast Ohio Black Health Coalition. Finally, Ronald Hickman, Jr., Associate Dean for Research at the School of Nursing at Case Western Reserve University. This, of course, a conversation we'll continue to have here on the Sound of Ideas. Today's remarks are on tape, but if you want to call and leave a comment, the number 216-578-0903 or send an email, soi@wcpn.org. We'll kick off the conversation with something that was discussed on the first panel. That's the fact that there have been proposals at the state level to declare racism a public health crisis, but little movement from the legislature. Here's perspective from Yvonka Marie Hall and then Ronald Hickman, Jr.
Just declaring racism as a public health crisis and not making sure that policies, not punitive policies, but policies that help uplift the communities, are put in place to go along with that public health announcement, it doesn't change anything. And so what we see is we have all of these voices saying, racism is a public health crisis. And they're like, oh, it's a public health crisis. But there's nothing, everything else falls silent. And so we have to make sure that our cities, our counties, our states, and our federal government have policies in place to help uplift the communities that are disproportionately impacted by racist practices.
So, Marlene, I'd love to jump in and just build on Yvonka's comments. And I'd say certainly we definitely need policy reform. And as a scientist, I'd say we need the evidence. How do we dismantle structural racism and sort of a population and system levels approaches? We certainly need the evidence. So I think the CDC weighing in on, racism as a public health crisis has certainly activated agencies like the National Institutes of Health to put forward new initiatives to really make this a research priority and provide evidence, scientific evidence, that can certainly help to inform our policymakers' decision-making.
Same topic, legislative movement following a declaration of racism as a public health crisis. Here's David Maywhoor from the Ohio Public Health Association remarking on potential actions that can be taken by citizens.
Well, one of the first steps that can be taken is to get to know your own legislator. There have been 2 concurrent resolutions submitted to the Senate and to the House declaring racism as a public health crisis. And those have been languishing because the leadership in both the House and the Senate have not moved them forward. And so we really need people to, that's House Concurrent Resolution 4 and Senate Concurrent Resolution 6. So we need House 6 and Senate 4. So we need people to make contact with their legislators to talk with them about something that is in their hands. It's not as if you have to create it. The language is there, and it is really important for people to take that first step. So that's a first step that people can take.
Here's David Maywhoor again addressing a listener question about remarks made by Ohio State Senator Stephen Huffman at the state level.
There's a question that was raised that I want to read the words to, if I may. This is from a participant. My state senator is a physician, yet he asked aloud if blacks were more likely to get COVID due to poor health habits like lack of hand washing. He also referred to African Americans as colored people. He has moved up in the state legislature over time. This happened this year. So when we start talking about how do we pull this issue out of the politics of where we are right now, I think it's going to be a long haul to do that. And when you see this kind of entrenched attitude, you have to know that we have a long way to go. And So I grew up in Lima, which is where the senator actually covers. I know what my dad meant when he used the word colored. There is no doubt in my mind. This was a slip, an unfiltered thing that happened, but that's how people talk in that neck of the woods. So our work is really, it's got to be persistent. It's got to be day to day. And your question was exactly right. It also has to reach into our churches. It has to reach into our social institutions and begin doing what Yvonka is doing and gathering people together to have these conversations about how we move this forward.
Again, Maywhoor was talking about Ohio State Senator Stephen Huffman, who made those remarks last June in a hearing about this very issue, declaring racism a public health crisis at the state level. After he made those remarks, State Senator Huffman was fired from his position as physician with his employer, Team Health. But early this year, he was appointed to lead the Senate Health Committee, as you heard, mentioned by Maywhoor. The declarations of racism as a public health crisis have been made by elected leaders everywhere, city and county level as well. But this panel focused on healthcare experts and what they wanted to see moving forward. Here's Dr. Charles Modlin of the Cleveland Clinic speaking to the perspective of the medical community on the health effects of racism and what's needed next.
Historically, whenever in the medical profession, whenever anybody would talk about health disparities, health equity, racism, it's a taboo subject. Over the past, decade or so, I think clinicians, physicians, medical researchers are starting to understand that when somebody talks about health disparities, you're not pointing the finger at them, as individuals. And so, I see that medicine, the medical profession is moving in the right direction. The CDC coming out and proclaiming that racism is a public health crisis, I think it is a very important step. However, they didn't go far enough because they didn't actually explain the pathophysiology in terms of how racism contributes to poorer health outcomes. And I've seen a number of TV commentators over the last several days, for example, disputing this, denying this, trying to push back on the fact that racism is a public health crisis. Now, we learn in medical school and physiology class that when somebody is undergoing chronic stress, and racism actually is a source of chronic stress, whether it's overt racism or microaggressions that people experience over their lifetimes. The physiology, the biologic basis for this is it sets off a cascade of hormonal reactions in your body. It affects your hypothalamus, which is a section of your brain, which sends a signal to your pituitary. These hormones then cause an increase in your adrenaline, your cortisone, which is a stress steroid, which can actually induce diabetes, high blood pressure. So there is a pathophysiologic, biologic basis whereby chronic stress, which is a result of racism, can actually cause physical manifestations of disease, which then can translate into, like Yvonka was talking about, mental health responses. There are research studies showing that there are structural and molecular alterations in the brains of individuals who are chronically stressed. So I think the CDC needs to go further and actually explain the biological pathophysiological mechanism, because a lot of people are pushing back and trying to deny that this is actually a real phenomenon.
Dr. Charles Modlin from the Cleveland Clinic. Next, we hear from Iris Harvey on the difference in medical needs and health disparities between men and women of color, in particular what she's seeing regarding women's needs being at Planned Parenthood of Ohio.
I think certainly when we look at Black women and maternal and infant mortality by gender, there are differences between, the white population. Probably our doctors could speak a lot more to the fact that we're seeing chronic illnesses, chronic diseases that are impacting both Black women and Black men, again, at a rate that is much higher than we see in the white population. I think some of the issues that have a great deal of impact on women that we need to think about is to the point of two of our speakers who said we actually need to put policy in place. That is where you get to the structural changes. And for me, I think when I think of women, policies that need to be considered would be for one thing, we all need a living wage, but certainly women who are increasingly the breadwinners in their family need a living wage, not just a minimum wage. We need a national family leave policy. Women are usually the ones who are taking care of the family, no matter who is in the household. We need to close the gender wage gap between men and women, because if you don't have the economic capabilities to take care of your family, there are a whole degree of health concerns because of social determinants of health. We need affordable childcare. If you are taking care of your family and you're making the decision between whether you leave your child with a poor caretaker or you go to a job, very often people make the right decision to stay with their children, but then that puts them into a bigger economic penalty. And I still think that we need a national health care program. I think the Affordable Care went, far, but we are the only developed nation in this world who is not able to have a great national system of healthcare, and it's shame on us. So I think those are some of the things that policies that we all can talk to at the state level. For instance, with Medicaid, and I think we're going to see some of this with President Biden, women the number of births that are paid for by Medicaid, that are supported by Medicaid, is very large. But a woman has her child and then there is no postpartum care. It's usually I think it's like 6 weeks. So we need to extend that at least to a year. And I know that is one of the policies that President Biden has put on the table. So I would say policy is one way of getting to structure.
That was Iris Harvey, President, CEO of Planned Parenthood of Greater Ohio, in conversation with other healthcare professionals in a panel discussion regarding racism as a public health crisis. The conversation was organized by the League of Women Voters of Ohio, moderated by ideastream's Marlene Harris-Taylor. Today we're bringing you some excerpts from that conversation. The comments are on tape, but if you want to weigh in, I see some people are on the phone lines, send us an email to soi@wcpn.org or use the phone lines. We've had conversations previously on The Sound of Ideas about the idea of reparations as a way to address health disparities, and that came up in this panel discussion as well. Here again, Iris Harvey on the idea of reparations.
I've seen just in the last couple of weeks, you're starting to see individual communities start to decide what they think is one step to reparation. I don't know that anyone has the true solution to it, but certainly I think for instance, Evanston, Illinois, that decided to give like a $25,000 bonus to African Americans in their community qualified to help them get housing. So I think it's the same type of thing. It's not the overall solution. It is one solution. If we say that we start with one step, that could be one way that communities could say, how do we have better health care? What is the way to, I guess I would say, compensate Black Americans for the tragedy of poor healthcare delivery, and just total neglect? Why not?
The executive director of the Northeast Ohio Black Health Coalition, Yvonka Marie Hall, added this.
About 15 years ago, we started putting equity into everything. Okay, we want to put equity in all policies. Well, for me, I think it's important for us to put reparations in all policies, and that way our children's children will still make sure that there is a reparations lens for them. So we have to have reparations in all policies.
Yeah, because if you think about what equity means, right? Reparation would be exactly the highest level of demonstration of equity.
Another subject that came up in this conversation, the issue of diversity within the field of nursing. Marlene Harris-Taylor, our moderator, asked Ronald Hickman Jr. from Case Western Reserve University's School of Nursing on if he's seen equity issues in the nursing field, particularly issues with bringing more African-American men into the practice of nursing.
To answer your question directly, no, we don't see the uptick in Black men becoming in nursing. I do see the uptick in white males going into nursing across the lifespan because it is economical. They can find jobs. There are a shortage and there's good pay. But we have a road to travel to convince Black men that nursing is a profession that is a noble and good profession for them.
What do you think the barrier is there?
I think there have been historical roles. I alluded to some of the sort of structural and maybe institutional practices that have denied men, denied people of color for entry. I think, just to be honest, there's, very few of me in institutions of higher education and in nursing schools. And I think we definitely need to move that needle to be more inclusive. But until we get there, we've got to start upstream, introducing the idea to our young people that nursing is a viable career, and dispelling some of the myths and maybe the stigma that is around men in nursing.
When talking about race and healthcare access and health disparities, COVID-19, of course, has to be a part of the conversation. Here, Yvonka Marie Hall addresses how COVID's affecting minority communities and how she herself is dealing with the long-term effects of the virus.
As a person who is struggling with COVID-19 as a long hauler, we haven't learned a doggone thing. We talked about this glaring light that COVID shed on all these inequities in our community, around testing, around access. And now we have the same thing going on with the vaccination. Do you understand that the light is still there? And I don't think that we have put enough emphasis on the fact that the things that happened with COVID, around African Americans losing their lives disproportionately. I've lost 35 high school friends, graduated in 1986. 35 friends have died from COVID. 63 days ago, I was going to die. I went to the hospital because two of my friends who are researchers said, we want you to go to this particular hospital. Don't go to the hospital in your community. And we need you to request this drug. And we need you to not leave until they give you the drug. And they gave me an experimental drug, belamimab. Dr. Marlene knows what I'm talking about. Dr. Hickman knows what I'm talking about. It is the same drug that Donald Trump, Chris Christie, Ben Carson, that they all took. That drug saved my life.
But so because you had that access.
But when I read about the drug, I found out that 300,000 units of that drug was put not into the urban community that was most disproportionately impacted by COVID, but in rural communities. So rural communities were getting a drug that urban community needed to save their lives. So I just don't think that we have got it. I don't think that we have got it.
Wow. And again, here's Dr. Charles Modlin from the Cleveland Clinic addressing COVID-19 vaccine hesitancy and the responsibility of physicians.
Yeah, we actually have seen a relative hesitancy in African Americans to accept and get the vaccine, but actually that is changing in national surveys. Back in October, only 43% of African Americans were willing, and the survey in January showed that about 61% of African Americans were willing to get the COVID-19 vaccinations. One thing I think we need to remember is why there is reluctancy and hesitancy. A lot of it is, the distrust of the healthcare system, Tuskegee syphilis experiment, many of the history that Yvonka Hall actually enumerated, some of that I wasn't even aware of. So we have to keep that in mind. We're actually living in a post-traumatic stress syndrome disorder state in many respects. And I think we need to understand that affects the way that we our willingness actually to access the healthcare system. And there are a lot of misconceptions out there. We as Black physicians, healthcare providers, need to be a resource to direct people to the right information about the COVID-19 vaccines.
Again, Dr. Charles Modlin, to drill down on that topic as well as looking at systemic changes that can help remedy that distrust. Here's Yvonka Marie Hall one last time.
We also have to understand that when we're talking about the African American experience, whether we're talking about mental health or physical health, we have to understand that 87% of the African American experience is our experience here from 1619 to 1965. And then the time from 1965 to now only represents about 13% of our time here in the United States. And so when we're looking at the setting around what do we know about African Americans, we have to make sure that we're taking into account that 87%. we have to look at the whole thing around historical experimentation and the whole mental aspect of what happened with our ancestors. Starting, 1830s is some of the first things that we started to note at the Baltimore resurrectionists, which is about 70 years. 1845, we talked about Tuskegee. We talked about the Lyle Station, Henrietta Lacks, the radiation study that was done on African American children, the lead paint studies, and then also the forced sterilization of African American women in the South. That's one of the things that Fannie Lou Hamer talked about a lot. She actually coined the term Mississippi appendectomy. And so the thing about African Americans is there were two times in our experience here that our health status actually improved. So there were two times between 1865 and 1872 was that post-war reconstruction. It's directly linked to the establishment of the Freedmen's Bureau. And so that Freedmen's Bureau allowed us to have Black medical schools, hospitals, and clinics that were throughout the South. The Freedmen's Bureau saved the African American community from extinction. And then the time between 1965 and 1975, which is the Civil Rights Movement. The Civil Rights Act outlawed racial discrimination in government funded health settings. And so what we looked at is Medicaid and Medicare, hospital desegregation, integrated staff and patients, community and neighborhood health centers, which gave people a place to go with folks that look like them. So when they were going in for treatment, they saw people and engaged with people who they knew from their communities who looked like them and who they saw at the grocery store and at the schools and at the other things that were going on in their communities. And so those things were important. Now, what has been happening lately around our current trauma is that since 2016, African American life expectancy has dropped 2.7 years. So our life expectancy has dropped from 75 years to 72 years. And then when we look at this whole COVID, when we look at what COVID has done, we have to understand that African Americans are about 2.9 times the rate of whites to be hospitalized, but about 1.9 times more likely to die. And we also know the mental health impact of COVID on different communities. And so one of the things that we did was we wanted to make sure that in our organization that we put together support groups for African Americans who either had COVID, had experienced loss from COVID, or are having our long haulers. And so we also have to look at anti-racism in hospital settings and make sure that that is part of the training and curriculum for our hospitals, and looking at how they're treating African Americans that are coming in for different procedures or that may be concerned about their health status.
That was Yvonka Marie Hall of the Northeast Ohio Black Health Coalition. Panel also included David Maywhoor of the Ohio Public Health Association, Dr. Charles Modlin of the Cleveland Clinic, Iris Harvey of Planned Parenthood of Greater Ohio, and Ronald Hickman, the Associate Dean for Research at CASE. Discussion organized by the League of Women Voters of Ohio, moderated by ideastream's Health Unit Manager Marlene Harris-Taylor. Tomorrow in The Sound of Ideas, another installment of our Learning Curve initiative. WKSU's Kabir Bhatia will be here. And one correction from our earlier segment, Brian Matthews from CASE called back. He said that the minimum amount of money given to interns from CASE was $5,000. That should have been $500. The maximum of that is $3,000. But again, they did get that to 24 students, so kudos to them. Have you missed any portion of this program, hear it again on demand online or by downloading the podcast, or tonight, 90.3 at 9. I'm Rick Jackson. Thanks for listening.
Support for 90.3 WCPN is provided by Tabletop Board Game Cafe in Ohio City, accepting reservations for the socially distanced cafe as well as the new Bubble Room, a private room for small groups complete with a separate cafe entrance and bathroom. Reservations at tabletopcleve.com. Cleveland Public Theater Station Hope, a virtual festival featuring artists performing social justice-inspired works inspired by important issues of today. Saturday, May 1st at cptonline.org/Station Hope. Northeast Ohio Regional Sewer District. Over the next 5 years, the Sewer District will continue to make water quality investments in Greater Cleveland. Learn more at a virtual meeting in May. More at neorsd.org/behindthebill.
You're listening to 90.3 WCPN, Cleveland. IdeaStream.